Treatment and management of bronchitis. Bronchitis is of two types, acute and chronic one. Acute bronchitis is curable. It can be treated in certain cases, whether it is due to the viral bronchitis, it is cured on its own by simple rest and drinking plenty of water and soup, taking normal precautions. While the chronic one is a permanent pathology, there is permanent narrowing of the airways. It cannot be reversed one to the normal condition, but certain medicines and the steps can be adopted to reduce the complaints of the patient. In acute bronchitis, symptomatic treatment is provided to the patient, bed rest, antipyretic medicine, acetaminophen, ibuprofen, paroxysms for muscle pain, joint pain, or arthralgia. When there is excessive cough with expectoration, we can advise patient proper cough syrups, antitussive syrups, and the expectorants, elixirs one, like Piriton one. So this can be treated by simple rest, then nebulization of the patient by normal saline, or in certain cases we can add Ventolin and also the steroid drops one. In chronic bronchitis, the treatment is prolonged one and it brings relief to the patient. He can perform his normal duty if he is not too much aged one. For that, we start treatment with the short-acting bronchodilators, long-acting bronchodilators. These are the medicines which dilate the airways, which are narrowed one by this pathology or the chronic bronchitis disease. These two medicines, they can be given by oral route, by intramuscular intravenous injections, by inhalers, and by the nebulizer ones. They are always given in combination form, short and long combination drugs, dilator drugs one. In addition to dilators one, we also use the corticosteroids, that is steroids one, for a short duration for anti-inflammatory process to reduce the inflammation and bring the or lessen the symptoms of the disease for almost 1 week. The prolonged use of steroid is not advised because it produces weight gain, edema, high blood pressure, diabetes estimation is increased one, and the immune system is suppressed by the administration of the steroid for long period. So these are the basic factors. In combination with steroids, short acting, long acting dilator medicine, we can bring pleasantness and the comfort to the patient suffering from this disease. In addition to these, there is psychotherapy to reduce the stress and depression factors produced by the disease by the psychiatrist. Also, there is role of physiotherapist. because we advise also pulmonary rehabilitation exercises so the lung capacity can be increased by the various exercise ones. Diet is advised which should be rich in vitamins, minerals, light exercise gradually to be increased one so the airways can be dilated and the maximum oxygen can be performed absorbed by the lungs, especially alveoli. So these are the various steps which are taken to bring relief and the comfort to the patient. But if there is decrease in the oxygen saturation, arterial oxygen saturation below 90, then we have to do supplemental oxygen administration, which can be given at home if the patient is suffering from chronic bronchitis for a long period. So it can be facilitated at the home also. So these are the various steps, preventive measures. The only and the main preventive measure is quit smoking altogether. Hatred to the smoking, educate the patient the hazards and the dangerous effects of the tobacco smoke. Moreover, sanitary measures, clean and neat livings, pure waters, fresh airs, atmospheres, hobbies to relax the patient in a nice atmosphere so that he can enjoy the life as far as possible.